Welcome back to For the Record. We're more than 2 weeks into the government shutdown after 10 votes on the funding bill failed in the Senate over disagreements on whether to include an extension to the Affordable Care Act tax credits. The chamber's next vote isn't until October 20th, making this one of the longest shutdowns in U.S. history. We spoke with Wisconsin lawmakers on either side of this fight, but let's start with Republican Congressman Brian Stile, who joined us earlier. What would the timeline look like to reopen the government right now?
Well, the moment there are 60 votes in the United States Senate to overcome the Democrat filibuster, we could have a vote to reopen the government immediately. Frustratingly, Democrats, including leader Chuck Schumer, refuse to do that. And again, this is a clean CR, no policy adjustments, continuing funding at current rates. It's functionally the same bill that Democrats voted for earlier this year. What changed is the politics, and what we're seeing is Democrats in the United States Senate putting politics in front of people. It's beyond frustrating.
And do you think Republicans are at a point right now where they can get those votes?
Well, we have seen a few Democrats come across the line. The Democratic senator from Pennsylvania and others have voted to keep the government open, recognizing that that is the responsible thing to do. The consequences of the Schumer shutdown continue to build. More and more people are getting hurt. Number of people are not receiving their full paycheck due to the Schumer shutdown. And so hopefully Democrats in the Senate come to their senses, reopen the government, and allow us to complete the negotiations that are in front of us.
So what do you say to Wisconsinites right now who could see their premiums go up?
I'd say call your Democratic senator and ask them to open the government immediately so that we can finish these negotiations to address the rising cost of health care.
Democrats have been critical of GOP leadership, specifically for keeping the House out of session for the last 4 weeks. Do you believe that the House should return?
The House has done its job. The House passed a clean CR now 4 weeks ago. And so the work is in the United States Senate to find 60 votes. Frustratingly, Chuck Schumer and the Democrats are utilizing the filibuster to prevent the government from being funded. They're holding pay for essential workers hostage to try to drive their political agenda.
Let's go now to Democratic Congressman Mark Pocan and why he says the shutdown has lasted so long. How long do you think this will last?
I think that's going to be up to the Republican leadership. They haven't called us back in. This was our 4th week of paid vacation that the House Republicans have not come to Washington. I've been there. I was there Tuesday and Wednesday, hoping that they would do the right thing and come. But, you know, this isn't just about holding your breath over a shutdown. We have a farm bill that's 2 years overdue. We have a bunch of other bills, reauthorizations that have to happen. And the fact that Congress just thinks that we can do nothing and have pina coladas at home is not a good idea.
House Republicans would argue on that side that they've kind of done their job here and it's up to the Senate now.
It's ridiculous, right? I mean, we all know there's many other bills. I think about 12,000 plus bills get introduced in Congress every session, right? There's other things we can do. It's just such a stupid argument.
Well, and Republicans said that they won't come to the table quite yet, and they'll be ready to talk about some of these tax subsidies after the shutdown is ended. What do you think about that?
So right now, their track record on truthfulness isn't so good. So what we're saying is right now in Wisconsin next week, people will get their rate increases for the Affordable Care Act. People right now who are employers are getting their rate increases for next year for their group health plans. This is the time to deal with this. If you do it after all the rate increases come out, people are going to be paying a whole lot more for health insurance, which is what we're fighting in the first place. So it sounds like a lot of rhetoric, but it's not rhetoric that's going to bring down the bills of health care for anyone in Wisconsin, and it's certainly not going to help the 15 million people that are likely to lose their health insurance.
And kind of on the other side of this coin now are federal workers here in Wisconsin that are going unpaid during the shutdown. What would you say to those individuals right now who may be struggling because of the shutdown?
Yeah, I think the federal employees are some of the heroes. You know, they're saying keep the government closed because this is about a bigger fight than just them. The fact that they're the ones telling us to continue this fight for everyone, the broader public, that really says something about how strong our federal employees are and how much they care about their jobs and helping the public.
Hear our full conversation on channel3000.com. And as congressional Democrats and Republicans continue to put the blame on each other for the shutdown, social services around the country are seeing the impact. That includes the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. The program provides services to nearly 60,000 families across Wisconsin. In its effort to keep WIC up and funded, the federal government has allocated $300 million in unspent tariff revenue for the next few weeks. But if the shutdown continues into November, these benefits could be at risk. Democratic Representative Renuka Mayadev authored a bill calling for the state to appropriate funds to the WIC program. The legislation is currently circulating for co-sponsorship. For now, WIC benefits and appointments are available. And the National Weather Service and the Federal Emergency Management Agency, or FEMA, are weathering the storm throughout the shutdown. The department employees are working without pay during the shutdown, meaning you'll still get your daily forecast and weather warnings. UW-Madison Research Program Manager Chris Vigaski says after significant federal cuts to the National Weather Service, the shutdown stresses an already strained department.
It was seen that after all of those cuts that we really needed to have a full staff of the National Weather Service to be able to get all the forecasting and all the warnings and everything done that we needed. But now with the shutdown, we can't continue with that hiring process, and that just pushes this stressed staff at the Weather Service even further, because it's going to take, once people are hired, 6, 8, 12 months before they're fully involved in the Weather Service. So it's just making that a longer process before the Weather Service is fully back and functional.
Vigaski also says the shutdown could have a monetary impact, as he says FEMA's disaster relief fund is starting to get dangerously low.
When that runs out, there's only about $7.5 billion left as of last month. So when that money runs out, that needs congressional approval to refill the DRF. And it doesn't take a major hurricane to drain that. You know, we had the flooding in Milwaukee this summer. That costs money. So it doesn't take a really big event, and luckily we haven't had that. But any sort of disasters that we see will cause that to drain down, and that will affect our ability to protect people or help them recover if this continues onward.
And for the record, we'll be back right after this.